Hi, everyone. Our interactive tool helps medical students quickly grasp the causes of secondary hypertension through clear, step-by-step guidance. It's fully responsive and works seamlessly on both laptops and smartphones, online or offline. Once you sign in with your Google account, you'll land on the main page with 4 key sections. Let's start with the diagnostic pathway. Clicking it walks you through the hypertension diagnosis process interactively. For example, let's say you have a patient. You've already checked their history and physical exam. Now you move on to lab tests. Based on the results, you might see low renin and low aldosterone levels, which points to something like pseudohyperaldosteronism. If you choose volume excess, you'll see 2 possible conditions. Clicking on one will take you to a detailed disease page. Let's check out Little syndrome. The page includes multiple sections. You can click through sections like epidemiology, pathogenesis, and there's even a references section. Under pathophysiology, you'll notice that the figures are clickable too. Figure 1. This shows the overall approach to low renin and non-low renin hypertension. You can easily spot Little syndrome here. Figure 2 focuses on renal pathophysiology. Little syndrome is highlighted again. These visuals help make complex topics easier to understand. You can continue exploring other sections using the navigation panel on the left, such as diagnosis, management, and more. Now let's go back to the homepage. Some users might be interested in a specific disease only. No problem. Head to the compendium. It's a collection of disease cards linking directly to their detail pages. No need to go through the full diagnostic pathway. Wait, what if some users want to see the big picture, to understand what they're learning, how the steps are connected, and where they're heading in the diagnostic flow? The interactive workflow is here to help. It provides a visual map of the entire diagnostic process. And it's not just a static image. It's fully clickable. Users can jump to any part of the diagnostic journey by clicking on a node. Let's say if you already know the patient has low renin, just click on plasma aldosterone concentration, and you'll skip the earlier steps and go straight to the next relevant test. Super convenient. Finally, the reference table offers a side-by-side comparison of disease features, like lab values, physiological defects, and treatments. Great for quick lookups and review. That's a quick tour of our hypertension educational tool. If you have any questions or suggestions, feel free to email us. We hope this tool makes learning more engaging and effective. Thanks for watching.